Okay, so we want to begin our discussion with mastitis and really focus on bacteria. What exactly is happening as we go through? So, just to kind of something I found might be helpful. If you're evaluating a farm, this is a good set of benchmarks related to milk quality, mastitis. We've got excellent, good, and needs improvement for standard plate count, lab pasteurized count, coliform count, somatic cell, and then do we have mycoplasma present, Staph aureus, or strep ag? And if we do, we're going to have to get rid of them in some way, shape, or form. As we'll see as we move forward, mycoplasma is not something you want at all. And good mastitis programs usually start by getting rid of Staph aureus and strep ag. Two of them. All three of those are very contagious. So mastitis in dairy cattle. We're looking at a definition. It's an inflammation or irritation of the mammary gland. Causes, it could be physical trauma, it could be some sort of damage by a chemical, some way, shape, or form, but more often than not, it's almost always caused by bacteria. Bacteria enter the mammary gland and they start an immune response. That immune response triggers local swelling, attracts white blood cells, which become our somatic cell, or as part of our somatic cell count, which is mostly white blood cells. So, a variety of bacteria can cause infections. We'll start our discussion on that with this sequence. So, for those of you in 220, we remember that management is the barrier between bacteria and the udder. What we do will affect whether or not those bacteria get inside the mammary glands and cause some sort of infection. So it's our job to do the things that are necessary. Nothing real magic. It's a lot of keeping up on the little details and doing things right. Clean, dry cows, clean, dry beds, clean, dry udders. So mastitis as an intramammary infection. And we want to remember that any disease, in this case mastitis, is a balance between the challenge and the defense. The challenge of the disease causing organism versus the defenses that the organism puts forth. Um, and in this case, we're going to add a layer that the man does, or humans do, or managers do to help keep the udders from becoming infected. So if we're going to have increased intramammary infection, that can be from increased challenge. Increased challenge overwhelming our defenses. We've got too much there for our defenses to take care of. So we're looking at more bacteria at the T-den. Anything that will cause that will lead to an increased challenge. So we can look at dirty environment, improper prep of the udder during milking, or a malfunctioning milking machine can all lead to more bacteria at the teat end and or into the mammary gland itself. We may have decreased defenses, so same challenge, but the animal has decreased defenses, and the lessening of defenses makes the challenge greater, and the challenge wins. So we can look at decreased immunity for the cow. The cow's defenses in some way, shape, or form are disrupted. We can think of stress, faulty vaccination schedules. We can think of poor nutrition, other illnesses that are going to predispose her or split the immune system away from the udder. We could also think about the barriers that the cow has, the skin, the keratin plug in the street canal, the flushing of the udder on a regular basis all can help keep the bacteria away from the teat ends. So that's the cow. Let's think about the human side of things, what we as managers might do when we don't maintain that management barrier. There's no barrier there. So either we've got too many things to do and we're just not getting things done, no time. We got a bad attitude. We're just, I don't really care. I don't want to. Sometimes those things happen. Um, just in life in general. Other times it's a function of your personality. It's just not something you care about. Maybe we lack understanding about how things happen, how infections could start, how mastitis gets a foothold. Maybe it's faulty execution. We know what we're supposed to do. We have it figured out, but we just don't get the job done in some way, shape, or form. So mastitis in our dairy cow is going to be put into two categories. Clinical, we're showing physical signs. We see from across the room that some way, shape, or form that cow has an infection, the cow has mastitis. So abnormal milk, abnormal in any number of ways. We see clots, we see flakes, we see watery milk, we see discolored milk, all are signs, outward signs of mastitis. The udder is affected. We see pain, swelling, disruption of the tissues in some way, shape, or form, causing the cow discomfort. Symptoms throughout the body: fever, anorexia, dehydration. She's depressed. She's outwardly appears sick. All these are manifestations of the clinical mastitis cases. Usually, and these are not hard and fast rules or perfect rules, but usually we're looking at somatic cell greater than 900,000 or a somatic cell score of 7, 8, or 9 plus. Subclinical can be just as costly to a dairy depending on the levels of infection. There are no outward physical signs. There's an elevated somatic cell. So I don't really know if that's a clinical versus subclinical, but that's the way everybody uses it for mastitis. To me, elevated somatic cell, that might be a clinical sign. But I guess you can't see that usually directly or without special measurements, so they're calling it subclinical in this case. So usually somewhere between 250 to 350,000 or 850,000, or a somatic cell score of a 4, 5, or 6. So this is going to fall in that window. We've got 0, 1, 2, 3 somatic cell scores. Uninfected, 7, 8, 9 plus are clinical. So subclinical falls in the middle there. It can stretch in either direction. They're approximate breakdowns. They're good for looking at DHI records. Use those categories to put them in there. But you can have an animal with fairly low somatic cell showing clinical signs. It's not a hard and fast break point. So when we're looking at clinical mastitis, we have to score it, and our scores will help determine how we handle that particular um, clinical mastitis. So we score a 1, we call it mild, and we're looking at abnormal milk only. 2, we've got abnormal milk plus the gland is involved, so pain or swelling, sensitive to the touch, hot, all those things where the gland is showing physical symptoms. The 3, we look at severe, or in extreme examples, toxic, where the milk is affected, the gland is affected, and the whole entire body of the cow is infected. So we've got the abnormal milk, the pain and swelling, and then the systemic effects of fever, dehydration, shock. Usually these are the coliform mastitises that are really going to include the entire body in that. So how do we remember this sequence? I want you to give some thought that how am I going to remember what a 1 is, a 2 is, and a 3 is? Yes, I think about it as how many things are involved, 1, 2, or 3. Um, so we can see 1, 2, 3 here, but there may be a progression that this is normally when we talk about it in class and everybody gives their different ideas of how they want to remember it. Maybe we'll talk about it on the phone. So again, we have our 123 American Association of Bovine Practitioners are at least this particular set of things here. We've got two different threes here. We got severe and toxic, so deadly on some level. Probably not deadly, but would certainly help if we did some things. So recommendations from the bovine practitioners are: one, we're looking at oxytocin and milking out, making sure that we get everything out that we can. Flushing the udder out of bacteria is really good. Um, Keep the load off the cow. Generally, the recommendation is no antibiotics, and we'll talk more about that over the 2 weeks here. Um, you might consider antibiotics if there's no response in 2 or 3 days. Our level 2, we're again doing oxytocin and milk out. We will consider, given the cow's reaction to that, maybe we can help her out by giving her some antibiotics in her mammary. But again, it depends on which organism we're working with. And we may give her whole body depending on how things are progressing and if we think it might have a chance of moving to a 3. 3, again, oxytocin and milk out, possibly intramammary infusion. Anti-inflammatory drugs would be very helpful to the cow at this point. Toxic, we really have to intervene to save this cow or help her out. So we've got systemic antibiotics, we've got anti-inflammatory drugs. We may provide her with fluids, either IV or oral. And depending on how bad things are, we may have to call the vet, how valuable that animal is to you. So one of the things we have in deciding a treatment is we have to identify bacteria, and there's lots of different dichotomies that you're going to run into. We're going to discuss two of them. What do we do with gram positive? What do we do with gram negative? What do we do with contagious? And what do we do with environmental? And when we're identifying bacteria, we're going old school here. Staining was the early way to sort through that. And there's lots of different stains depending on what you're doing. What's called the gram stain is the most basic, and it's the one way to pretty much divides the microbial microbial kingdom into two different categories. So you take some bacteria, put them under a microscope, and you add the gram stain. If you have something that looks like this, bacteria is holding the stain and is said to be gram positive. Bacteria do not hold the stain. We're going to have a gram negative. The bacteria are not purple under a light microscope. So what does that mean, more or less? Gram positive, they're going to have fewer layers in their bodies or their one-celled organisms. You got the plasma membrane here, and then there's a peptoglycan that forms the outer shell. Gram negative, we have an extra outer layer, lipopolysaccharide and proteins. So we've got fats, we've got carbohydrates, we've got proteins. All of those are going to be in that outer layer. Gram negative, that stain can't get in like it can for the gram positive. And color that, and that has implications as to how we treat the animals or treat a cow to eliminate the mastitis, whether the animal or microbe is gram positive or negative. So for those of you that have a more interest in this, what the differences are between the gram positive things here, things like no endotoxin versus endotoxins, susceptible to penicillin, not susceptible to penicillin are things that we're going to use, the characteristics we're going to address in our discussion of how do we handle mastitis. So you've got the lipid membrane, you've got a smaller peptoglycan here, a bigger one here, but you've got that outer layer that affords some defense and prevents penicillin from working. So the key point of all this is identification directs our treatment. And if we're thinking about just gram positive and gram negative bacteria, gram positives are going to need, as a rule, intramammary antibiotic treatment. They respond to penicillin-based treatments or penicillin-derived treatments. So those gram positives, because they lack that extra outer layer, penicillin can come in and disrupt things, and you're going to have success often, but not all the time, with penicillin against your gram positives. Gram negatives don't respond to intramammary treatment of the antibiotic, specifically focusing on the penicillin based. That extra outer layer gives them or confers on them kind of an immunity to penicillin. What we see is E. coli, Klebsiella, mycoplasma are examples there. Usually with these gram negatives, there's those endotoxins, and we have to think about treating the whole body to get the animal recovered and moved on. So gram positive, we have that lacks that extra outer layer, responds to basic antibiotics, specifically penicillin and penicillin based, is a formidable enemy to the gram positive. Some of the players we're going to talk about there are two contagious bacteria that are gram positive. So these two are also called contagious. Strep ag and Staph aureus are two that respond very well or can respond very well to antibiotic treatment, especially penicillin based. When we're thinking about gram positive, we're thinking about strep ag and Staph aureus. We're also talking about contagious. And contagious is about milk transfer. We got infected milk from one animal getting to infected milk of another animal, so transferring from one udder to the next. So we need to keep things clean. So proper milking hygiene, proper milking operation, uh, proper dipping pre and post, dry cow treatments have been pretty successful against these gram positive contagious bacteria. And then if we've got issues with Staph aureus, a staph cow becoming chronic, we may consider letting her go, culling her, if we have the animals to allow or prevent them from getting other animals. So we're thinking about gram positive, we need to know they are there. So the one way to do that we'll show you is culturing. Now, if we've got a bad somatic cell issue, these two organisms usually are the first ones if we haven't been diligent about a mastitis control program, haven't been doing a real good job of controlling things. Strep ag usually can take over a herd, as can Staph aureus. If we culture and come back with strep ag, we know this is one of the few bacteria that can be successfully treated with antibiotics during a lactation. There are very few other bacteria that are recommended that you take a chance, uh, put antibiotics in the udder to get that animal cured. Staph aureus is about a 50% cure rate. This has not so much their susceptibility as gram-positive, but how they behave in the udder. The Staph aureus tend to wall themselves off, and it becomes difficult for that penicillin to breach that wall and kill off that bacteria. So usually we talk about um, getting them early before they wall off. Once they wall off, you're probably never going to cure that. One of the more effective approaches is the higher dose of antibiotics that's associated with the dry cow treatments. So getting that in there, making sure that we're getting a full dose in there, milking that cow out, then putting the antibiotics in is an opportunity to possibly get those Staph aureus out. The problem is they wall themselves up and they tend to hide in the upper udder. So getting those antibiotics up all those ducts can be a challenge. Gram negative as a group of bacteria types, they have that extra outer membrane that acts as a shield. Um, Antibiotics don't work, or at least the penicillin based ones don't work. They don't kill. Penicillin disrupts the layers of a gram positive with that extra outer layer, that lipopolysaccharide and protein. The gram negative can hold itself intact and fight off a penicillin attack. The gram positive will, both of those layers will be disrupted. The animal explodes, or the bacteria explodes, and that's how penicillin works. When we're thinking about uh, gram negatives, we often think of um, our coliform mastitis, Klebsiella, um, E. coli. We're looking at environmental um, organisms in that case, coliform usually coming from the GI tract at some point, but E. coli is more or less ubiquitous. It's found everywhere in the soil, um, different strains, different places, but more or less continuous. Uh, they're generally not contagious. It's hard to pass that from one animal to the other, given the short duration and how fast the udder puts things out. We usually think about poor bedding, manure getting to the teat end. With our coliform mastitis, we're looking at something that's very acute, very aggressive, but short lived. And we're looking at the type 3 um, severe or toxic mastitis usually. So a swollen quarter, abnormal milk, fever, sunken eyes, your endotoxins that are released as the bacteria are destroyed are going to have some very negative effects throughout the body on these cows. So those gram negatives, coliforms are going to produce endotoxins. They're going to lead to that toxic mastitis. So you're going to have a high fever associated with that. The endotoxins are going to depress intake. They're going to depress water consumption. I just don't feel good. I don't feel like getting up. All those are going to lead to problems. The quarter swells and the milk becomes very watery. So we've got, definitely a 3-level mastitis, and we can have either severe or toxic, depending on how what the magnitude of these symptoms are. So the idea is hypertonic saline is an opportunity to flush out those endotoxins, giving her that IV. She drinks a whole lot of water, and all that stuff gets flushed out. The endotoxins get flushed out through the kidney. With coliform mastitis, you're going to have to deal with gram negatives, so you're going to do a much more broad spectrum antibiotic. You need something besides penicillin or is more aggressive than penicillin. IV fluids, hypertonic saline with buckets of water is probably your best bet at this point. You also want to help with the swelling, so antiprostaglandins, i.e. aspirin, are helpful. Frequent milk outs help lower the load on these animals. If we think about frequent milking and oxytocin, there are some places, well, it works, it doesn't work. But here's the theory behind that. If you have one bacteria in a ideal environment, which we're going to call the inside of the udder, you got all the food they can consume, it's wet, it's watery. You're going to have um, in 4 hours, the doubling rate of every 15 minutes, about 4,000 colony units. 8 hours, you're going to have 8 million colony forming units from one bacteria in 8 hours. In 12 hours, you're going to have 16 trillion. So if we do more frequent milkouts, we keep the load of bacteria down as opposed to this ridiculous amount down here. So every 4 hours, we can keep those flushing out, getting rid of the bacteria, flushing them out, and not allowing them to live and multiply in the udder. Coliform mastitis prevention, it's pretty much clean and dry. So we're trying to prevent those environmental bacteria, the manure to get in the teat end. So clean, dry bedding, pre and post dip are going to destroy those bacteria before they can get in the teat end. Or we might think about short term. If you got a problem, if things aren't dry as they should be, we start the use of lime, bring some dryness there. Long term, you might think about changing your stall management and checking to make sure your pre and post dipping are the proper strength. They're on there long enough, and everybody's doing a good dip and coat. And we're also cleaning as we take care of that stuff. So again, the difference between gram positive and gram negative is that extra outer layer. With that, we need to knowing the difference between the two helps us direct our prevention measures, helps direct our treatment measurements. So we're going to take a gram positive and kind of switch over to environmental versus contagious. Environmental, often gram negative, are caught from the environment. As a general rule, they're always around. It's a question of numbers. To keep the numbers down, we try to keep things dry. And we could think about it as a challenge and defense. The challenge gets high enough, it's going to break through the defenses and affect the udder. So we've got streptococci is gram positive, think entero is gram negative, and our coliforms are gram negative as well. Contagious, we're looking at mastitis that's caught from another cow. So we have infected milk getting into the milk of the other cow and infecting that milk. So this is very much a demonstration that management needs to be the barrier between the bacteria and the teat end. Strep ag, Staph aureus, mycoplasma are all examples. Strep ag, Staph aureus are gram positive. Mycoplasma is gram negative. So when we're looking at our specific bacteria, trying to identify which ones we have. Once we identify, we can go with a specific treatment plan, and each bacteria, as we'll present over the next 2 weeks, has a specific plan of attack. So our thing is to find out as quickly as possible what we're dealing with. So here's a chart. Should have that in your printouts. We're looking at gram-positive on this page, staph, streps. We've got Staph aureus is contagious. It generally has a very long duration of infection. You're usually going to pick it up in increased somatic cell as a rule, and then you're going to have them blow to clinical cases on a regular basis. The site of the infection, we have micro abscesses. The Staph aureus goes in, digs into the tissue, and walls itself off. And once it's dug in, it's burrowed in, it's very hard to get rid of it. So chronic infections, we have a very low cure rate, less than 35%. New infections, before they get walled off, we have better success. So up to 70% cure rates if we get on them early detection and getting them taken care of. So these are usually with antibiotics. Strep aglatia is a contagious one. This is usually historically the big problem. If you're doing things right, generally strep ag goes away very quickly. Doesn't self uh, doesn't self cure at all, just like Staph aureus. So you're going to see increased somatic cell. It's rare that you're going to see full blown mastitis with these. They tend to colonize on the surface tissues of the secretory cells, which makes them very easy to treat with penicillin. So greater than a 90% cure rate for those identified. And again, strep ag, strep aglatia, strep ag is one of the few that we really focus on using antibiotics with. You got your two strep species, Dysaglacia and Uberus. Environmental, contagious, length of time is variable. You're going to see increased somatic cell. Clinical cases, antibiotics are not as effective as our strep ag, but they have a chance to be effective through 75%, 3/4 of the time. And again, we're looking at penicillin-based treatments. These are the ones that you tend to have success with. The second half of that diagram, we have our coliforms, mass environmental, generally a very short duration, but it's a severe acute mastitis. Normally, we have a spontaneous cure. We keep her milked out. We keep her flushed. We treat her symptoms, her pain, her dehydration, her lethargy, not feeling so good. Flush the system out. Get rid of the endotoxin. She's usually takes care of it. Antibiotics really aren't necessary. Coagulase negative strep species, all environmental, variety of things there. Again, we're looking at spontaneous cure rate. We're not looking at antibiotics in any way, shape, or form. Last, this one is gram negative, so negative, positive, negative, negative, positive, negative. Gram plasm, Mycoplasma bovis is a kind of an amorphous bacteria. It doesn't really have an outer shell, so penicillin can't disrupt the shell and kill it. So we're looking at something that's very contagious, very long lasting. You've got high somatic cells. You've got colonization of the udder and then throughout the body. And the cure rate associated with this is very, very low. If it runs through your herd, you have my deepest sympathies because probably the only way you're going to get rid of it is to start culling animals. Got that diagram there. Um, Print that out and make notes on it if you wish. So this, if we got a culture report back with these various species, what do we do with them? So we've talked about contagious, 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 environment, environment, environment. how they're spread, cow to cow, cow to cow, cow to cow, environment. Let's focus over here on the control of these. So strep ag is very much transferred when we used to use common towel, very easily going from animal to animal on your hands, on towels. So we want to use separate towels. Teat dipping, very responsive to dry cow treatment. If you're daring, you might treat her during lactation, but you're going to make sure she stays out of the tank. Staph aureus, you're going to have some of the same sorts of things. It's a gram positive, it's contagious, so separate towels. Dry cow treating, milk infected cows last is a pretty standard practice. We're trying not to expose the other animals, so we clean the milking machines before they're used again on healthy animals. We usually have to use culling in here. Chronically affected animals, they just can't cure themselves. Every time their immune system goes down, there's a flare up, and sometimes those flare ups actually blow out the side of an udder. Mycoplasm, there's not much you can do. Just don't get it in your herd. So watch when you're purchasing, making sure you're doing all the things that prevent contagious. And you're probably going to have to get rid of any animal that comes up positive for that because there's no real cure once they have it. So prevention is the key here. The environmental, pretty much the same stuff. Clean, dry cows, clean, dry stalls, clean, dry environment. Keep the animals standing up after milking. Teat dip before and after are all cited as things that help control that mastitis. So here's kind of a summary: environmental versus contagious. Environmental, proper milking machine, uh, clean dry bedding, clean environment, clean dry udders, pre-dip, post-dip, keep the cow standing up after milking. Are contagious, we're trying to prevent milk to milk transfer, proper milking machine function. Be careful when you're buying cows, especially for mycoplasm. Milk infected cows last, machine sanitation, proper milk prep cleanliness, pre-post dip, individual towels and wipes, and if we get into severe cases, prevention. It might prevent the disease from spreading to another animal, but culling is sort of iffy in that prevention, other than it prevents other animals from being infected.